They have been classified as essential service providers, driving the East African community economy from Mombasa through Uganda to Rwanda and Burundi. But now the government says these drivers could be driving the coronavirus along the transport corridors. New rules are now in place to control this.
Before any driver starts his travel, make sure that you have your COVID test done 48 hours in advance. Why 48 hours? Because of the method we are using for testing, the real-time PCR, it takes about 24 hours to release your results.
After getting tested, each driver will keep safe his COVID-free test certificate and present it to health officials at various checkpoints.
We have, in that respect, therefore, placed a number of testing centers also along the transport corridor, because not all journeys are going to start in Mombasa. Should you start your journey in Kisumu, there should be a testing facility in Kisumu.
For those coming from other countries, they will have to be tested at border points, even if they have a COVID-free certification from the country of origin.
At your designated stopovers, you will encounter public health officers who will again be able to monitor you, and should you develop symptoms along the transport corridor, they will be able to link you with the county rapid response teams and refer you to quarantine facilities or isolation centers.
The government has meanwhile warned hoteliers who reopened their businesses without following the laid-down public health protocol that their businesses will be shut down.
There are others that have just seen the good Kenyans who have also opened those restaurants, but are operating beyond the hours that are set, because in the guidelines we said you can operate between 5 a.m. and 4 p.m. As late as yesterday, some were open up to 9 p.m. This is total disregard of law. And as I said, CSR, we will not hesitate to close down those facilities and prosecute the owners.
Today, the country has registered the highest number of recoveries. 32 patients were released from hospital, raising the number of total recoveries to 239. But 2 people died today, all from Mombasa County, raising the death toll to 32. After testing 1,056 people from various parts of the country, 23 people tested positive, bringing the total number of COVID-19 cases in Kenya to 672. Once again, Mombasa County recorded the highest number of positive cases at 12. Mandera County joins the leaders with 6 cases. Nairobi recorded 4 and Kajiado County 1 case. In Nairobi, Umoja Estate recorded 2 cases, while Komarok recorded its first case. Many have linked the case in Komarok to the movement of people from Eastleigh area, which was put under lockdown. Pipeline Estate had 1 case too. In Mombasa County, Mvita area reported 8 cases, Kisauni had 2 and Likoni 1. For Mandera County, after mass testing of over 200 people in the areas considered hotspots, 3 people tested positive in Mandera East, while in Elwak, Mandera North and Mandera West had 1 case each. Meanwhile, the Ministry of Foreign Affairs had released a COVID-19 breakdown of Kenyans in the diaspora. According to the data, a total of 191 Kenyans in the diaspora have been infected, out of which 23 have so far died and 4 remain in intensive care. 10 Kenyans have died in the United States, 6 in the United Kingdom, 2 in Italy, and 1 each in Switzerland, Saudi Arabia, South Africa, and France. Dennis Matara, K24 for The Punchline.